Standing by now with a look at how Intermountain Medical Center is helping patients.
That is correct. And here to tell us about Intermountain's Partnership in Healing program, registered nurse Michelle Vandegraaff and Dr. Samuel Brown from Intermountain Medical Center. They were the researchers in this new program, and it's really involving the whole family or caregivers, caretakers. How does the program work?
So what we do is we invite a family member into the caregiver team, and we found out that they're really one of the most motivated parts of the care team, and usually, and this program came about. First, I was in the Peace Corps and saw that the families take care of the patients in the hospital. They all come. The extended family comes. And because of that, when we came to Intermountain Medical Center, I saw that we had needs for caregiving, and noticed that the family is often just there and wants to participate.
And Michelle, this makes so much sense because it really helps in the healing process once the patient gets home.
Mm-hmm. It does, yeah. And what we found, we've done a study that's been published in Chest magazine this month, and what we found is that 65% fewer readmissions with the group of Partners in Healing patients compared to a control group.
And this is a study that you guys did over 9 years.
Yeah, we've been working on this on our unit for 9 years with 465 participants, and we've matched 200 participants compared with a control group, and we based it on age, on the date of the year of service, the surgery, the surgeon, and then we found this great readmission rate.
And Dr. Brown, are we talking? I mean, what are we talking about? These family members, loved ones, are learning everything that a nurse can do?
Yeah, I think realistically, when a loved one is suffering or getting through a major surgery like a heart bypass or a valve replacement, families often feel powerless, confused, disoriented, in over their heads, and then you spring them home, and all of a sudden there's no supports. Like, what do they do? So Michelle came up with this outstanding program that says, look, if you want to, you're clearly invested in them doing well. Let's give you the skills to take care of them. And you sort of deputize them as deputy nurses.
So they're coming into the room, and the nurses are there, and they're given tasks to do this, that, and the other.
Exactly. Yeah, and we now that we're opening it up to more than just our surgical patients, we give them skills that they can use depending on what they're there for. So for like a surgical patient, we'll teach them deep breathing and coughing and activity. Heart failure patients, we're teaching them how to weigh the patient, how to take their blood pressure, and how to keep track of their fluids. So it's very patient-specific.
That's incredible stuff, and empowering loved ones, right? And so that their patient will not have to come back to the hospital.
Exactly.
Exactly, yeah.
Thank you so much. A great program.